Hi, my name is Dr. Vikas Kohli. I'm a pediatric cardiologist, and today we are talking about pulmonary hypertension, which means high blood pressure in the lungs. This is the Pulmonary Hypertension Week, and we would like to educate the community about pulmonary hypertension. This is a rare condition, but still not that rare. What are the causes of the blood pressure in the lungs going high? Most commonly in India, there are two main categories. Number one is if somebody or a child with heart disease since birth has not been diagnosed early enough and not been treated for it at the right time, then his lungs could be permanently damaged and result in high blood pressure. 40% patients belong to this category. The other category is the idiopathic or the unknown cause category, whereby a patient has high blood pressure detected incidentally and no cause can be found. Multiple tests have been done. It's called the idiopathic group, and the patient remains with that diagnosis. This is 50% of the patients. So how does a patient present who has high blood pressure in his lungs or pulmonary hypertension? The patient could be having shortness of breath while walking, climbing stairs, exerting, something he or she was able to do earlier but is not able to do now. This is a very, very important symptom. And in addition to that, if the person has any other new symptoms related to breathing difficulty, requiring more pillows at night time to sleep and is sleeping at a higher angle, or there is blueness of nails or around the lips, these are all signs that the patient may require a test to make the diagnosis. The test is called echocardiogram, which is ultrasound of the heart. And the echocardiogram is the one and only test which will determine and ascertain that the lung pressures are high, and the patient would then end up with a diagnosis of pulmonary hypertension. What is the treatment of such a condition? The treatment is medicines, it's not surgery. The medicines are usually given in a combination of a single medicine or two medicines or three medicines. They all work in three different ways. We are lucky to have these medicines cheap in India. They are manufactured in India and supplied all over the world. These medicines in US are so expensive that majority of the patients cannot afford them. These medicines make a tremendous difference to the patient's lifestyle, quality of life, but not necessarily to the ultimate outcome. So this condition doesn't get cured, and I want to emphasize this. This condition is a condition the patient has to live with and very gradually will keep progressing. So it's very important that the family understands this aspect, that the condition's diagnosis once made, patient has to take the medicine all along and has to continue with that, including with other additional treatments if ever needed. So the outlook doesn't change dramatically, but it changes with one fact. When do you make the diagnosis? If the diagnosis is made very early and the patient is less symptomatic, medicines will improve him, bring him back to normal, and he'll lead a pretty normal life subsequently for a very long time. But if the patient's condition deteriorates and we start medicines, there'll be only a slight improvement and a significant difference from the normal condition of the patient, and the patient will exist like that. If it's so very bad that the patient is actually very sick and we give medicines, it may make no difference to the patient's outcome or the patient's clinical condition. Dear friends, it's very important that if somebody is having these symptoms, they get an echocardiogram done and evaluation for pulmonary hypertension, appropriate medicines be given, they reach the right doctor for pulmonary hypertension. Today the medicines are of a variety of type are available. I treat patients who are both children and adults with pulmonary hypertension. I've been doing this for 25 years, and we have successfully managed and done procedures also on such patients who require such procedures to be done. We under Child Heart Foundation are also treating children under 18 years of age and providing them medicine lifelong for pulmonary hypertension. It is my request that if you know somebody who has these symptoms, or if you know somebody who has pulmonary hypertension, then you let us know about it or let them know about us so that they can benefit. Thank you very much.